So we conduct our own self-sponsored research each year to extend our knowledge, and this year we're focusing on the consumerization of healthcare and how it's affecting several related industries. We're happy to be able to present this to you and glad that you joined. So what do we mean by the consumerization of healthcare? As you likely know from being in the industry and from all of us being consumers, greater costs are shifting to consumers, especially with high deductible health plans. And simultaneously, there's more competition with signs that consumers are expecting more convenience and fewer barriers in healthcare. Likewise, consumer-oriented companies are looking to try to influence healthcare delivery, and they're often in the news, and some headlines can highlight that impact. Um, some of you may remember when Apple's health records came out not too long ago, putting patients more in charge and having some extra information that patients can access. Fitbit is often in the news, trying to transform healthcare. A year ago, back in 2017, around the holiday times, consumer DNA testing really blew up, and starting to see those ads again, getting more and more people to engage in that. Some of you may remember the news about Amazon, Berkshire, and JP Morgan teaming up to try to disrupt healthcare, and that had a big impact on everybody's thinking about the evolution of healthcare delivery. Uber and Lyft are out there trying to bring ride-sharing to healthcare and making inroads there. And then there's often articles and interest in millennial doctors and patients and what they may mean for shaping the healthcare world and what those patients and doctors' expectations are and how they may differ by generation. And then just this past September, some of you may know that the latest Apple Watch came out, and in this version of the Apple Watch, there's actually an ECG monitor and an algorithm for detecting atrial fibrillation, and even a mechanism for detecting fall detection. So, so that device has the potential as a really popular device to bring medical monitoring devices into the hands of a much larger population, and maybe a godsend for healthcare, or maybe a potential healthcare headache. So what we wanted to do with our research objectives was to really explore the emerging state of healthcare consumerization. We wanted to look at readiness, both among consumers and physicians, in terms of consumer technologies, such as wearables like Fitbit and Apple Watch, apps, use of health apps, consumer DNA testing or screening, ride-sharing, remote monitoring, and telemedicine. We also wanted to look at physician and consumer readiness around what we think of as more consumer-centric convenience initiatives, patient portals, self-scheduling apps, new sites of care like telehealth, urgent care, and around price transparency. And we wanted to try to better understand what demographic differences might be influencing healthcare consumerism, like the impact of different generational approaches. We also have an eye towards what unmet needs both physicians and consumers have around these issues. What are the gaps? Where are physicians looking for guidance? Where are consumers looking for guidance? Excuse me. And finally, trying to understand who both physicians and consumers see as thought leaders on these areas. So the approach that we took was to conduct both qualitative and quantitative research, a multi-phase approach. We often do this in research for our clients, not always, but often. It's really the best of both worlds, as many of you know. In Qual, we get to do discovery research and deep dives into whys. And then in Quant, we have more robust samples, and we're able to quantify attitudes and practices. This presentation, this webinar is on the phase 2 quantitative. We already presented the phase 1 qualitative. Happy to share that deck with anyone if you're interested, if you didn't receive that already. In the phase 1 qualitative, we did in-depth interviews, 10 with primary care physicians and 10 with consumers, with a mix by different demographics, as you see on your screen there. In the phase 2 quantitative, we tried to take some of the learnings from the qualitative and bring them into the quantitative and optimize what we had learned in the qualitative. And we designed a physician survey targeting 100 PCPs in a 10-minute survey, and the consumer survey with 300 online surveys among consumers. It's important to note that the physician research here is limited to primary care physicians, so results among specialists may differ depending on their subspecialty. But among the 100 PCPs that we surveyed, um, we designed it so we'd have a mix on subspecialty within primary care, a mix of health system affiliation or independent, a mix by generation, geography, and gender. And similarly for the 300 consumers, we have a mix on types of insurance, generation, geography, gender, and ethnicity. So first I want to highlight some of the findings around primary care physicians, then we'll do the consumers, and finally the key takeaways. So among the primary care physicians, um, we asked PCPs about their readiness to use consumer technologies to care for their patients. So we asked them about how ready they are to talk with their patients about health apps, talk with their patients about wearables, have their office help patients with ride sharing for medical appointments, actually talk with their patients about the results of consumer DNA test screening, or their readiness to manage their patients with remote medical monitoring devices, or their readiness to provide telemedicine. And what we see is that most PCPs say that they're ready to discuss health apps or wearables with their patients. So the large majority say they're moderately or completely ready to talk with their patients about wearables, about patient apps, and that's consistent with what we heard in the qualitative. We start to see a big drop-off when we look into ride sharing, and we see almost 4 in 10 primary care physicians say they're not ready to have their office help patients arrange for ride sharing for medical appointments. And then we see a big drop-off around the other consumer technologies. We see that about roughly half are not yet ready for consumer DNA testing, remote monitoring devices, or telemedicine. And in fact, telemedicine's at the bottom. About half say they're not ready to provide telemedicine. 4 in 10, almost 5 in 10 say they're not ready to talk with their patients about consumer DNA testing. And again, that's consistent with what we heard in the qualitative. When we take a look at this by generational cuts, we get to see some different results. And it's important to note for this PCP study that the cuts are pretty thin by generation here. We just have 100 total. So we have 30 to 35 millennial, we have 35 Gen X, and 35 boomer PCPs. So use some caution in these generational comparisons. But we see that readiness for using health apps, millennial PCPs feel much more ready than their boomer counterparts, with 7 in 10 millennial PCPs saying they're ready to talk with patients about health apps. And again, that's consistent with what we heard in the Qual. And it's interesting that even around remote monitoring devices, one of the areas where physicians don't feel quite ready, PCPs feel much more ready to work with remote monitoring devices in the primary care space than their generational counterparts do, but it's still below half. It's interesting to us that we're not seeing generational differences around readiness to discuss consumer DNA test screening or to provide telemedicine. So, that low readiness is still really consistent across all generations. So even the millennial PCPs are not yet feeling ready to discuss consumer DNA tests. They're not yet ready to provide telemedicine. We then asked PCPs what consumer-oriented health tools will have the most positive impact over the next 5 years. And interestingly, PCPs are most excited about the future of telemedicine on patient care. And that's despite telling us that they're least ready to provide telemedicine right now. So you might think it'd be natural for them to kind of poo-poo telemedicine because they're not ready to deliver it right now, but they're actually pretty excited about the future impact on their patients in just the next 5 years. We also see that the sort of optimism about health apps is also stronger among millennial PCPs than among their generational counterparts. They're more optimistic than Gen Xers or boomers are. PCPs are optimistic about telemedicine because they see it as offering more access, convenience, and better health in the primary care space. When we talked to PCPs about telemedicine in the qualitative, they were fully behind it for specialty care. They thought it was fabulous for specialty care. They could see that that logic really clearly, and they definitely had less familiarity with it in the primary care space. So it's interesting to see how optimistic they are about it here. By access, PCPs are telling us that they really think telemedicine can have a role for patients who are away at college or those with transportation challenges. And some of those examples of folks with transportation challenges are brand new moms or patients in rural areas who have to travel farther. And for some of these PCPs, it also means fewer barriers to just keeping appointments or greater opportunity for them to check in more often. So greater access is a real compelling reason for PCP's interest in telemedicine. By convenience, they're telling us that they appreciate that some patients want to not drive, or they don't feel that they really need a face-to-face visit for some conditions. And we see that some PCPs agree with that. Not all, but many see that argument as well. And by better health, they see it as another tool to prevent ER visits or worsening health or decompensation at home. They see it as a way, some of them even see it as a way to get insights from seeing patients in their natural environment. And in fact, we had a pediatrician call that out, both in the Qual and in the Quant, that sometimes that can be valuable to see your patient at home instead of in the office. We also asked PCPs what consumer-oriented health tools will have the most negative impact over the next 5 years. And here we see that PCPs are most concerned about consumer DNA tests impacting their practice over the next 5 years. About a quarter of PCPs cite this as having the most negative impact on patient care over the next 5 years. And it's interesting that it's actually the younger generations who have the most concern about that. So maybe a little counterintuitive, but as you can see on this slide here, millennials and Gen X PCPs are more concerned about DNA testing than boomers are, maybe because they have more insights into it. We didn't really think that sort of a 5-year window meant that these boomer physicians are going to be out of practice, that they're going to be leaving the field. So we don't think they're not concerned because they won't be seeing it. My hypothesis here is that the younger generations feel more of the burden, that they're going to be seeing a lot more of this and maybe have more insights into it themselves and are more concerned about it because they know a little bit more about it. We also see 19% of PCPs who say telemedicine will actually be a negative over the next 5 years. So that's sort of the flip of the prior finding that more PCPs are excited about telemedicine. And when we look into those reasons, those PCPs who are concerned about telemedicine, excuse me, their concern is really about lower quality care. They think that there'll be lower quality care from telemedicine, or they're worried about overprescribing through telemedicine. So it's really consumer DNA testing that leads the way here as a negative concern. When we ask PCPs about that, and they tell us a little bit more, what they're really worried about is having proper guidance and good data quality. And by proper guidance or a lack of guidance, what they mean is they really don't know what to do with the consumer DNA test screens. They're finding it difficult to counsel patients, difficult to get referrals for patients. They're frustrated that the commercial tests don't supply genetic counseling as part of the service. They're also worried that it leads to unnecessary visits and maybe wasted resources. So they clearly need more information, more support around that. They're also worried about inaccurate data in the sense that they worry about the validity of the commercial DNA screening tests. And these are just about the commercial tests like 23andMe and Ancestry.com. They're also worried a little bit about a false sense of security in that the tests do not test for all possible mutations and not necessarily the same number of mutations that other medical tests will. So they're worried that those consumer screens are not testing enough of the mutations, and patients may have a false sense of security from that. A third reason not up on the screen is over-testing. That's a close third as a reason why PCPs are concerned about consumer DNA screening. Excuse me. And this is consistent with what we heard in the qualitative in phase 1. We were also interested in PCP's initial reactions to the Apple Watch, and particularly the ECG monitor and the Apple Watch. As a potentially popular remote medical monitoring device, it's really interesting to get an early look at primary care physicians' reactions to what their role might be with this type of medical device in primary care. For specialists, for cardiologists, it may be an easier link to understand how they can use this information, but you can really anticipate what the impact could be on primary care physicians with many more patients who don't have a cardiovascular diagnosis coming in with an Apple Watch and saying, my ECG monitor is showing me X, Y, and Z. What can you tell me about this? And what does that mean for primary care physicians? And what we see in this Quant survey is that the ECG monitor really gets initial mixed reactions from primary care physicians. In fact, a third of PCPs expect that it'll have both a positive and a negative impact on their practice. And again, surprisingly, it's the younger generations who have more of a mixed or negative reaction to the ECG monitor. Not necessarily negative, but more mixed, more caution, just like they do about the consumer DNA screening. The millennial and Gen Xers, are more likely to say they can see that this new device is going to have positive and negative, not just a positive impact, more like the boomers are saying here. So again, it's the consumer DNA screening and the Apple Watch where the younger generations are a little more cautious. When we dig into what those mixed reactions mean, it really focuses on PCP's concerns around data accuracy, bumped up against their hopes for better patient health. And their data accuracy concerns are around both false positives and false negatives. So they're concerned with patients coming in thinking they have a heart arrhythmia when in fact they don't, or about the accuracy of it actually missing patients who may have heart arrhythmia. So they expect some glitches, they expect false positives. Concerns within the accuracy are related to concerns with patient anxiety, added office visits, over testing. At the same time, the upside is they are hopeful that it can lead to better health. They are hopeful that it can identify some cases earlier. The primary care physicians who are really positive about the ECG monitor in the new Apple Watch, it's mainly based on their belief that it really will lead to better health. They expect that it will help diagnose rhythm disturbances that they and their patients can't detect now. And these physicians who are positive, they actually jump on the idea that it will provide more accurate data. They expect it'll provide better data than they have now. They focus on the idea that they'll have long-term data, which they don't have now. And they think that this will actually provide more accurate data. Those who, the small batch there, 9% who just have negative ratings, it's mainly focused on their expected inaccuracy in the data and then the consequent patient anxiety and excessive testing. We also took, our whole list of consumer health tools, consumer health technologies. We had a list of 11 consumer health technologies, and we asked PCPs about what their top interest is in learning more about each of these consumer health technologies. And out of that list of 11, their top interest is learning more on how to work with these three services in primary care: remote medical devices, telemedicine, and patient health apps in primary care. And it's just interesting, I think, to recall that PCPs said they were least ready now for devices, telemedicine, and consumer DNA screens. Interestingly, they say they're ready for patient health apps, but they're still interested in more guidance in that area. Despite millennial PCPs saying they're readier for devices and patient apps than other generations, there really aren't dramatic differences by generation in terms of what they're interested in hearing about. These three top needs cut across generations. As you can see, the fourth top need is how to work with consumer DNA screens. So they're concerned about it, they want more information, but really the tops are remote medical monitoring devices in primary care, telemedicine in primary care. Also interesting to note, PCPs say how to work with a patient cost estimate for prescription drugs. That's also in the top half of issues where PCPs want more guidance. We also wanted to take a look at the potential impact of Amazon. Amazon is another disruptor in healthcare and potentially another player in healthcare consumerism. So we asked here about the potential impact of Amazon on medical supply spend in PCP practices. And note that this question asked physicians to just exclude office supplies and prescription medicines and vaccines. We told them that the question is just about medical supplies. And what we see is that when we ask them what they're currently doing, about half of primary care practices are not using Amazon for their medical supply budget now. And that's even truer among health system affiliated practices. They're directionally more likely than independent practices to not be using Amazon right now. But then on this next slide, we asked PCPs to think about the next scenario, and we said, just think 5 years from now. What % of your practice's medical supply budget, if any, do you think will be ordered through Amazon instead of medical supply distributors like Cardinal, Henry Schein, McKesson, Medline, and so on? And we asked them the same thing, just focus on medical supplies, exclude prescription drugs, and so on. And what we see is just 5 years from now, most PCPs expect their practices will be spending more of the medical supply budget with Amazon. That scenario before where half are not spending any of their budget with Amazon, that drops way down. And that change to using Amazon cuts across both physicians who are in health systems and those who are in independent primary care practices. We also see that about a third of these physicians expect their practice to be spending 10% or more with Amazon in the next 5 years from now. So it's an interesting part of consumerism. Here consumers are used to using Amazon in their homes and in their home lives, and it probably facilitates the ease of considering this option in their business life. So those are some of the key findings from the physician part of the survey. Just to jump into the consumer findings, we had the same kinds of discussions with consumers. We asked consumers a similar set of questions about consumer health technologies, asking them about their interest in remote medical monitoring devices, telemedicine, consumer DNA screens, talking to their physician about health apps, talking with their physician about wearables, or ride-sharing for medical appointments. And we see that most consumers, like PCPs, they're also most interested in remote monitoring devices and in telemedicine for their health. Those are the top two for consumers, just like they are for PCPs. But interest is really split among consumers in DNA test screens or in talking with their physician about health apps or wearables like Fitbit or Apple Watch. And this is consistent with what we heard in the Qual. Many consumers are using these wearables, but there's a barrier when the question is about talking with your physician about your health app, Fitbit or Apple Watch. Same thing, many physicians using consumer DNA tests, but do you want to talk with your physician about it? In the Qual, what we heard was that many patients said they weren't quite yet ready to talk with their physicians because they felt their physicians weren't tech savvy. They really didn't expect much would come from it. But physicians said they were ready to have those conversations. So this split in interest in consumer DNA screens and talking with your physician about health apps or wearables, that split is partly by generation, with millennials much more interested in these technologies, in the DNA screens, talking with a physician about health apps or Fitbit or Apple Watch. So as you can see on this screen, we have among the millennials in green, 6 in 10 to almost 7 in 10 saying they're interested versus 3 in 10 to 4 in 10 among boomers. So definitely a generational difference here. We also see that the younger generations, the millennials and Gen Xers, they're also more interested in telemedicine, but it's more of a directional difference, not as statistically significant. And just a note, our sample sizes here by generation among consumers, we have 100 millennials, 100 Gen Xers, and 100 boomers. Lastly, general interest is lowest among consumers for using Lyft or Uber for medical appointments. Almost 6 in 10 saying they're not interested. We see that ride-sharing interest is higher among urban and suburban residents than rural residents. It's higher among those with Medicaid, perhaps because they have more transportation issues. It's actually higher among millennials and Gen Xers, presumably because they're more used to ride-sharing. And we didn't really see a big difference among those who have or don't have chronic health conditions like asthma or diabetes. But we do see a big difference when we split out these results by those who have and haven't ever missed a medical appointment or seen a doctor because of a transportation issue. So basically what we're seeing here is that ride-sharing interest is very high among consumers who have ever had a transportation challenge when trying to see a doctor. So on that left side, we can see that the interest is 7 in 10 of people who have had a transportation challenge for a medical appointment. 7 in 10 of those folks are interested in learning more about using ride-sharing for a medical appointment or getting help from a doctor's office for ride-sharing, and much, much lower among those who have never actually faced that challenge. We also asked consumers out of this list of 11 consumer health tools what their top interest is, what their top need is for information. And consumers tell us they most want information on telemedicine, on estimating medical procedure costs, and on remote medical devices. So there's some similarity there with PCPs who are also interested in telemedicine and remote medical devices and getting more guidance, getting more best practices on that. And then particularly for consumers, having some way to estimate the cost of medical procedures. Close behind those top three is more guidance, more information about consumer DNA screens. And these tend to be the same top three needs or interests across generations. We also find that many consumers, they trust their physician, but they're relatively reluctant to share their health app information with their health insurer. So consumers will discuss health app results with their physician, but health insurers are rated even slightly lower than the app manufacturer. So maybe not surprising for some, but there's a gap in trust in sharing health app information with one's own health insurer. When we split those results by generation, we see that millennials in particular credit a health app maker over their health insurance. So 62% of millennials have confidence in sharing their app information with the app maker, but less than 50% would feel as confident in sharing that information with their health insurer. And here the question was posed as sharing this information to try to learn if that source had programs that might help you with your fitness goals. And what's behind that, maybe not surprisingly, is that consumers are really worried that sharing health app data with their insurer may lead to increased costs. That's far and away the top concern among consumers about sharing that information. There are related barriers of trust, being worried about being dropped, or security, but far and away it's a worry about a downside increased rate increase by sharing that information. So one can view healthcare consumerism, or one view of healthcare consumerism is around consumers doing price shopping when they can, and when they can is a big if. We see relatively few are doing it now. We ask them if they are shopping around for the best price on prescription drugs, if it's not an emergency, and only 15% said they're doing that now. We asked if they're shopping around for the best price on non-emergency medical procedures. We gave them a list of examples: colonoscopies, cataracts, cosmetic surgery, knee surgery. 1 in 10 say they've done that now. Diagnostic testing, like getting an x-ray, again, if it's not an emergency, and again, most saying no, they're not doing that now. But interest in doing this is really strong. More than half to almost 6 in 10 say they're interested in doing that. And we break that out by generation. We can see that it's the younger generations who are most interested in that. Um, more like 6 in 10 of millennials and Gen Xers said they're interested in shopping around for the best price on all three of these different variations on medical price shopping. Boomers, consumers with Medicare are the least interested in the need to shop around. And results like this about interest in price shopping don't really differ much by whether consumers have a high deductible plan or if they self-report that they've ever had a problem paying a medical bill in the past 12 months. So these generational shifts seem to make more of a difference here. Lastly, there are several other generational differences that can affect consumers' expectations for healthcare interactions. We just wanted to call some of these out. Um, Millennials actually trust childhood vaccines. When we give them a list of several childhood vaccines, ask them about their trust in childhood vaccines, they're actually similar to boomers, with almost 9 in 10 saying they have strong trust in childhood vaccines. It's the Gen X group who have had all of the concerns, seeing information in the news from celebrities or about autism. They're the most vulnerable generation here about trusting childhood vaccines. Not so with millennials. But millennials really question the need to get a flu shot. They're much less likely to feel that it's important to get a flu shot than boomers are. Millennials are also much less likely to have a primary care doctor, a doctor they consider a personal doctor, maybe making them more open to urgent care or telemedicine, not as concerned with seeing their personal doctor every time they have a healthcare question. Whereas boomers, almost 100% say they have a primary care doctor, they have a personal doctor. So again, we see that generational difference when we ask about willingness to choose a telemedicine visit over an urgent care or a next day in-office visit. So we asked consumers what they would do, what would be their first reaction if they needed to see a doctor same day. Would they choose telemedicine? Would they choose urgent care? Or would they just wait for a next day in-office visit? We gave them a specific example. And millennials are much more interested than the other generations in using telemedicine. So just to sum up, I think the key takeaways from the physician part of this quantitative research is that nearly half of PCPs don't feel ready currently for telemedicine, for consumer DNA screens, or for remote medical monitoring devices in primary care. They do feel ready to talk with patients about health apps or wearable health data, particularly millennial PCPs do. And of all the consumer health tools that we assessed, PCPs are most excited about the future of telemedicine in primary care. They're interested in guidance on how to work in primary care with telemedicine. They have a lot of questions that came up in our qualitative as well. And they're interested in guidance about remote medical monitoring devices in primary care. They know about it from working with specialists who are primarily responsible for that remote monitoring device. They hear about it through their patients. They know their patients, some of their patients, for example, patients with cardiovascular problems or sleep apnea problems are using those devices, but they're not primarily responsible for it. But they're very interested in how that can help them in primary care. Conversely, PCPs are most concerned about consumer DNA test screens negatively impacting their practice over the next 5 years. They're really worried about lack of guidance on how to counsel patients and about inaccurate or incomplete data. And as a new consumer health device, the Apple Watch with the ECG monitor really gets mixed initial reactions from PCPs. A third expect it will have both a positive and negative impact on their practice, and they have concerns mainly about false positives, patient stress, and added office visits. There's an opportunity there to provide primary care physicians with more guidance and best practice on how to deal with that. Lastly, for the physician part, 5 years from now, most PCPs are expecting disruption. They're expecting their practices will be spending a greater share of their medical supply budget with Amazon. Both independent and health system practices expect they're going to be migrating their spend from traditional medical supply distributors to Amazon. For the consumer part of our survey, like PCPs, most consumers are also interested in telemedicine for their health. Likewise, they're interested in remote medical monitoring devices. We really see a parallel between the consumer and physician interest here, and they want more information about it, how it works, and if telemedicine may support their health. Their interest is mixed for consumer DNA testing or talking with a physician about health apps, Fitbit or Apple Watch. Again, they're using these consumer technologies, not convinced about talking with their physician about it. The split is partly by generation, with millennials much more interested in these consumer health technologies. And interest in Lyft and Uber for medical appointments is very high among consumers with transportation problems. You know, in our sample, it's 1 in 7. It's 14% of our sample said they have missed a medical appointment or not seen a doctor because they didn't have transportation. That's a small number, but it's not an insignificant number who could get help with ride sharing for medical appointments. Fourth, many consumers are relatively reluctant to share their health app information with their health insurer. Millennials in particular feel more comfortable sharing this data with an app manufacturer than with their health insurer. I think that's kind of striking. There's an opportunity there to somehow find a way around that barrier and to build greater confidence. And lastly, as we think about healthcare consumerism and shopping for healthcare, we see that relatively few consumers shop medical prices now for prescriptions, diagnostics, or procedures, even when they're not an emergency. However, many are interested in doing so, particularly Gen Xers and millennials. And we had one primary care physician in our qualitative tell us that, you know, he feels, and I think this is really insightful, that whoever can first fix this issue of price transparency, he thinks that they're going to win big among consumers and win big in this area. That price transparency is a problem waiting for a great solution, and whoever gets there first is going to make a really big dent in working with consumers. So thank you on behalf of both Zeldis and Schlesinger Group. Really appreciate your time. We know you're busy this time of year and appreciate you hearing this webinar and participating.